All right, everyone, we have on Hannah Gill, and I found her through like a doula group that I was in, and she's really passionate about VBACs. And you guys all know that I constantly post things about VBACs, but she's way more educated on the subject than I am. And I'm really excited to dive into it with her and to just really encourage people who are listening who maybe have had a prior cesarean that doesn't have to be your only path of birth. Or even if your doctor's telling you that you have to have a cesarean right now, to maybe question that, get another opinion, because yes, where cesareans do save lives, they are 100% there for a reason. There's 100% valid reasons to have a cesarean, but we're also like almost 20% above what our cesarean rates should be. So that means like 2/3 of the cesareans happening shouldn't be. And that's affecting our maternal death rates. It's affecting infant mortality rates. It's affecting all of us as a country. So I'm really passionate about this. I know Hannah is extremely passionate about this. So I'm really excited to have her on the episode. So thank you for coming on.
Yes, thank you so much for having me. I'm definitely excited. I love talking VBAC. I could talk for it about it for hours every single day. So
Right. I know. My husband and I, we were recently talking because I get on birth tangents every day, all day. And he gets on like remodeling the house tangents. And the
hmm
other day he's like, so I was thinking we could do this, this, this. And I'm just looking at him. And then I smile and he's like, you're not listening to anything I'm saying, are you? I'm like, no. I'm like, it's going in one ear and out the other. I'm like, I just can't envision what you're saying. We're not like at the place where we're gonna remodel yet. So I can't even
hmm
like, we're not doing
Think
it yet.
about
So I
that.
can't,
Yeah.
yeah, it's like, I don't even know when this would potentially happen. So I'm not thinking about it. And then like later that night, I started going on a birth tangent and he was like, in one ear, out the other. Like,
Yep.
he's like, I know, Liz, I've heard it 1,000 times. Like, you don't have, and I'm like, no, but I'm on my rock right now. Like,
I know. I get
so
so passionate about things, and he's just like, "Well, I don't understand."
right. Yeah. But they're educated, right?
Yeah.
And I've heard even my husband make comments to some people like a few times, like when they're like, oh, yeah, our doctor said this. And my husband's like, really? Like, you should look into that because I don't think
Yeah.
that's right.
Yeah.
So, yes, we will dive into VBAC and you'll get to see how passionate we are about it. So, tell us about, I guess, like your story. Like, what made you um, want to become a doula and more specifically a VBAC doula and kind of like your birthing journey that brought you here.
Yeah, so before my first birth, I was the first one like out of all my friend group to have a child. No one else in my family was really around the age that they were still having children. So I just kind of went into it doing what I thought everyone else did. I went to an OBGYN that I had seen before. I went to the nearest hospital that was highly recommended to me. I did like the basic birth prep through the hospital, took like their 6-week course or whatever it was. And then the only real thing I knew I wanted to do, I wanted to go unmedicated. I have a history of like spinal issues. I've had lumbar punctures and stuff, and I didn't want to have anything else in my spine. So I knew I wanted to go unmedicated, and I took an advanced labor class through the hospital, which was basically like a 2-hour class going over comfort measures and stuff to help you get through labor unmedicated. But I didn't do anything else to actually prepare for that process. After that, I was just like, I took the class and everything just shut off. And I just thought I was going to walk in and birth unmedicated. And I ended up going when I went to labor, I went into labor at 39 plus one. And my baby was measuring big, of course. Now I know that that is
It's
not something
a whole lot
that's
of crap.
yes. So ultrasound was saying he was going to be like 11
Oh,
pounds.
geez.
Yeah. So, and my doctor, my OBGYN, she was like one of those unicorn OBs that like, she didn't make it like a big thing. She was like, well, ultrasound's saying like your baby could be 11 pounds. Like if you want to schedule an induction, you can. If not, it's up to you. She's
Yeah.
very like nonchalant. It's all your decision. And that's what I love about her. Um, but anyway, I did end up scheduling an induction because I didn't know any different. But thankfully I went into labor before my
Yeah.
induction. I went into labor at 39 plus one, and I was scheduled at like 39 plus five for my induction, I think. So as soon as I went into labor, like my contractions started so intense and so close together that I was just really thrown off because everyone I talked to said, they're going to gradually build over time. Like even weeks before labor, you start feeling them, they'll get stronger, closer together. And mine, as soon as they started, were like, I can't breathe. They're 5 minutes apart. What is happening to me? So I called my husband right away, said we need to go to the hospital. And we did. Got to the hospital, I was 3 centimeters, and my contractions were like I couldn't even breathe through them very well, and told him I wanted an epidural right away. So as soon as we got admitted, I got the epidural. And from there, I just rested. I slept. My husband was like, well, I thought I was going to be like doing more to
Yeah.
support you. And he like took a nap. I took a nap. I took a nap with the peanut ball between my legs, and I progressed very, very quickly, especially for a first time mom. And around 9 centimeters, I wasn't at 9 centimeters for like a long period of time, but it was longer than I had been at the other dilation. So my OB, she said, do you want me to break your water? And of course, I didn't know any different. I was like, sure, yeah, break it. Awesome. As soon as she broke my water, I quickly dilated to a 10. And I did labor down for a while. So I didn't start pushing right away. It wasn't one of those instances where I was 10 and then we started pushing. And my OB she specials her patients. So even if she's not on call, she'll come to your birth. So she was actually over in clinic seeing her regular prenatal patients and then would walk back over to the labor delivery unit to check on me. So it was a while before I started pushing, but my epidural was so, so strong that I
Mhm.
did not feel any urge to push. I didn't feel anything. I couldn't even tell I was having contractions. I felt no pressure, which I mean, I thought like, okay, this is normal, right? Like it's supposed to take away all the sensation, but I didn't realize that I would need to like be able to feel something to actually push.
Mhm.
And of course, I was just pushing. I wasn't flat on my back, but I was semi-reclined. My legs were up. At one point they were in stirrups. At one point they weren't. My nurse and my husband were just holding my legs, but I couldn't feel the sensation to push, so I wasn't pushing effectively whatsoever. And after about 4 hours of pushing, uh, we just opted for a C-section. I was like, well, obviously this baby's not coming out, right? He just kept like turtling. He would come down
Yeah,
and then
yeah,
go
yeah.
back up and then come down and go back up. And we realized after the fact that he was asynclitic. And of course, like an asynclitic baby is going to be a little bit harder to birth, but easier if you're moving around and getting in
Right,
different positions to push. But I was not
right.
doing that.
Mhm.
Um, so we opted for the C-section, and it was at that point that things started getting like a little bit more intense for me. Like I was just so shocked and thrown off because I hadn't mentally or physically prepared for what a C-section would look like. And I just thought like, well, this only happens in emergencies, and this isn't an emergency. I was stable, my baby was stable. It's just something like I was pushing for so long. We chose to do that. So I was very thrown off by it. And I knew it was serious, more serious when my mom came back to the room. She was like bawling. And I was like, well, that just made me cry and worried me. My mother-in-law had had two C-sections at one point, so it wasn't a big deal to her. She like knew that process. Um, so I went back for the C-section, and when they started, it was way more painful than I thought it would be. They told me I would feel pressure, but I was experiencing what I perceived as pain,
Mm.
which I was surprised because my epidural was so strong. I was like, why am I
Right.
feeling this? Um, so I started crying. I told my husband, like, can you tell the anesthesiologist, like, I am in pain. This really hurts. So the anesthesiologist quickly, he gave me something else. I don't know what he gave me, but it helped take away that, and I kinda dozed off, and I was so, like, out of it. I don't remember my son being born. I don't remember him crying. And when I dozed off, like, I woke back up and I heard my son yelling, "Babe, it's a boy," because we didn't know it was a boy at that time, so my husband was like, "Babe, it's a boy," and he was so excited, but I just don't really remember anything because I was just so out of it. Our nurses took pictures, but that's all I really remember from was looking at the photos. So that's the actual C-section experience is where it started getting traumatic for me. The birth before that wasn't an issue. And then immediately postpartum, I hemorrhaged way more than they would have liked. I thankfully did not need any transfusions, but I went hypotensive. At one point, my blood pressure was like 60 over 40 or something crazy. So I was on the verge of like passing out. But my main concern was that my son nursed right away. So I was worried about him nursing and not worried about the fact that I'm passing out. So I'm having my husband hold him on my chest. I'm like, make him nurse. And I'm like, falling asleep. And that was my main concern. So it took them a long time to get me stabilized and recovering, get my blood pressure back up, control the bleeding, all of that. But uh yeah, the postpartum period was just like a shock to me. And it was like I was in so much pain physically and mentally and emotionally. And I knew like right away, like 5 weeks postpartum, I was like, if I have more children, that is not happening again. This cannot be how it ends up. And I felt really failed primarily by like my childbirth education. I didn't feel like it really prepared me for what a C-section could look like or the instances that this could happen. Um, so originally I had planned to become a childbirth educator, and I did that training. That's where I started first because I wanted to make a course that would really prepare women for everything that could happen and all their options for birthing. Because before that, I didn't know what a doula was. I didn't know what birth centers were. I didn't know these were options for birth. So I felt really failed because obviously the hospital class focuses on the hospital and all of their things. And
Yeah.
they're not going to recommend home birth to you or a birth center. So that was what I wanted to do first. It was become a childbirth educator. And then as I was going through that, I really started researching like VBAC. I had never heard the term VBAC. I just assumed that if you had a C-section, you just go on to have a vaginal birth. I didn't realize there was such a pushback against it or a stigma against it. I just thought this is what women do. And then when I went down the rabbit hole, it was like, oh my gosh, this is like a big thing. People are not doing this for various reasons, and there's a lot of pushback against it. So I listened to all the podcasts, read all the research, like read all the articles, found all the Instagram and YouTube channels, and I just started going down a rabbit hole. And I knew my next birth just it had to be different, and I wanted it to be different. So I did a lot more to prepare for that. So with my second birth, I started interviewing doulas before I was even pregnant. I got pregnant around 19 months postpartum. So my son was almost 2 when I got pregnant, but I interviewed doulas before, so I knew exactly who I would hire when I got pregnant. And when I was looking into my birth options for like my location of birth, I wanted to go to a freestanding birth center. But then I quickly learned that in Indiana, where I live, it's illegal to be back in a birth center that's out of the
Yeah.
hospital. It's not even like allowed.
Hmm.
Um, so that option was immediately taken off the table for me, like right away without even knowing it. So at that point, I looked into home birth options as well as hospital. And the midwives in my area for home birth, they either A, won't service, I'm pretty rural, so they won't service my area, or they don't take primary VBAC. So if you've never had a vaginal birth before, they won't take a first VBAC. The closest midwife I found was about 2 hours away that would service my area and support a primary VBAC. And I just didn't feel, with how quick my first labor
Right.
went, it was 13 hours total from my first contraction, 4 hours of pushing to my C-section. I was like, I don't know if I really feel comfortable with a midwife 2 hours away and like driving that far for my appointments and stuff. And I was like, okay, I'll just go with the hospitals. But I looked at different hospital options. There's hospital midwives in our area, but I just didn't really like jive with the hospital midwives. And looking back now, I'm glad I didn't go to this specific location because there's a lot of negative experiences with my own clients there.
Hmm.
Um, so I did end up staying at the hospital I gave birth at with my OB, which most people will tell you not to do. Like they will say, don't stay with the OB that did your C-section. But like I said, she's like a unicorn OB. When I mentioned VBAC, she was like, well, yeah, like duh, you're gonna do that type of attitude. And she had no stipulations put on me, like no limitations. I didn't have to be induced by a certain time. I didn't have to have an epidural. So those types of things. She was very, very supportive of presenting all the risks to me, both VBAC and C-section, and kind of just leaving that up to me. Um, and again, she specials her patients, so she'll come in regardless if she's on call. So I stayed with her, and it ended up being a wonderful experience. I had my doula, I had my OB, and I pretty much declined every intervention that I didn't want. My pregnancy was a little more complicated. I had subchorionic hemorrhages multiple times during my pregnancy. I had a partial placenta previa. I was GBS positive. I had a marginal cord insertion. So I had all these things happening. I was like, this can't just be simple, can it? Um, but I didn't let it worry me. Like I knew I had done so much research. I knew all of my options with all of that. And I I wasn't going to be induced this time. I knew I didn't want to do that. I was happy letting my body wait to go into labor. I didn't do cervical checks or sweeps or any of that this time either. And I went into labor at 40 plus 2. But this time it was a lot different than the first time. So I didn't have contractions. I just was excessively bleeding.
Mm,
And that's how my labor started. And my first thought was, oh my gosh, I'm having either a placental abruption. I wasn't having pain, I was just bleeding.
yeah.
So I was like, this isn't a rupture because I'm not in pain, is what I
Hmm.
was thinking. But I thought, well, maybe my placenta is like detaching and abrupting. So called my doula, called my OB, and they're like, yeah, like go in, like, let's see what's happening, where all this blood's coming from. So we went in to triage. They checked me and they couldn't really find where the blood was coming from, but I was stable. My baby was stable. So they weren't majorly concerned. They thought, well, maybe this is like a partial abruption. But the bleeding quickly started dwindling down. And I was about 4 centimeters when I got there. And we were going to just go back home. I was like, okay, so I'm fine. Baby's fine. Like bleeding subsiding. We're going to go home. Right. And we decided to be monitored for about another hour just to like make sure the bleeding didn't pick back up or anything. And at that point, I was starting to feel contractions, but they weren't like anything major. Um, but within that hour, I progressed to 5. So I was progressing quickly again. So we just decided just to stay there. Like we were already there. I was progressing. I wasn't in like major pain. So we were going to stay there. So I texted my doula and I was like, yeah, we're going to be admitted. Nothing's really major right now. My contractions are minor, but they are happening. So she said, okay, just keep me updated. And I was GBS positive, like I mentioned. I did choose to get the antibiotics. So we got back to be admitted and they did the first round of antibiotics. And then I detached from the IV. I didn't have a continuous IV. I just had them detached so I could move around. My hospital thankfully had wireless monitors. So I just wore those and walked around. And I did do like hypno babies to prepare at this time for going unmedicated, which I loved. I loved that experience, but I didn't really start listening to my tracks in time. So I tried to lay down and like listen to them and take a nap, and with the peanut ball between my legs. And immediately I was like, no, this is the most uncomfortable thing. I cannot do this. I need to go to the toilet. Because I'm like one of those people, major TMI, but I have bowel movements like my whole labor.
Yep.
It doesn't stop. So I just wanted to be on the toilet anyway. But after about like 30 minutes of being on the toilet, so this is like quickly after we got to the hospital, I start sweating. I start shaking. I rip my hospital gown off. I'm like butt naked and sweaty at this point, and my doula's not there yet. I had just texted her before we went to the toilet, like letting her know, like, oh, things are picking up, but like nothing major. So she's not there yet. My husband's like rubbing my shoulders, wiping me down with a or a cold washcloth, and I'm clearly in transition, but at the
Yeah.
time I'm like in denial.
Right.
And I told him, I'm like, Scott, I need an epidural. Like I can't do this. He was like, but you're doing so well, like breathing and swaying and working through these contractions. And I got annoyed with him at that time.
Yeah.
I was like, okay, whatever. And then my nurse walked in, and she was also wonderful. And I told her, I was like, I need an epidural. And she's like, well, you don't even have an IV. She knew. And she's like, you don't even have an IV in. It would take us at least 20 minutes to get the IV and all the fluids going before we can get the anesthesia. And I was like, okay, whatever. And then my doula walks in and I tell her the same thing. And she asked, well, how long have you been on the toilet? I said, about 45 minutes at this point. And I said, my contractions are on top of each other. Like, why are they like this? And she said, well, your body's obviously working to bring your baby here. She said, let's try a different position to see if that helps, like, change their frequency and intensity. And she wanted me to get in the shower, and I was so hesitant to even get off the toilet. I was like, you are crazy. I'm not moving. But I did reluctantly. I got in the shower, and I'm so glad I did. She put warm water on my back. I was holding on to my husband, and I was bearing down like immediately as soon as I stood up, and that gravity
Yeah.
took took over. But I was bearing down, and my nurse comes in because I'm clearly like vocalizing, and she can tell I'm bearing down, and she's like, well, maybe we should like move to the bed, like let's make sure you're complete. Because it was really quick. It was very, very quick. So I was at that point, I was like, yes, like just check, make sure I'm complete because I don't want to be pushing against a cervix that's not complete and have it swell and do all this. So I was complete. I had like a lip or whatever they call it, but my doula just said, let's go get on hands and knees and that'll help like distribute the, the pressure on your cervix and it'll be fine. But I'm pushing at this point, regardless of where I am. My
Yeah.
body was pushing. So we did get to the bed. I pushed on hands and knees for a little about 10 minutes. I pushed on hands and knees. And I knew that pushing was going to be the hardest part for me because like mentally, because I pushed for 4 hours before and nothing happened. And that was like my mountain to get over was pushing. So I pushed for about 10 minutes in hands and knees and my daughter kept coming down and going back up again. I was like, are you freaking kidding me? Like, why does this keep happening? And then my doula suggested, well, what about a squat position? Like, do you feel comfortable with that? And at that point, I was so exhausted. I was like, there's no way I can hold myself up in a squat. Like I'm gonna I'm gonna need like that extra support. But we got the squat bar. My husband supported me, like, my doula supported me. And within 5 minutes and two pushes, my daughter was out. Like she
Yeah.
flew out.
Mm-hmm.
Um, so it was like quick that she came out, 15 minutes total of pushing. Her head wasn't, there was no molding. She came out so fast. She was just like out of there, which is good and bad, depending
Right.
on like how fast
Right.
they come out. I had a second-degree tear, so nothing crazy, but my doula was trying to have me control my breathing and control my pushing. And I was like, no, just get this baby
Right.
out of me.
Right.
And my body was just pushing anyway. So, yeah, it was wonderful. I had no major complications, with my VBAC. It was 4.5 hours total from first contraction to baby, which was a lot faster than my first, but I kind of expected it because my first was so fast. But I had no break. It was so intense and so quick that it
Yeah.
was like there was no break at all, which was kind of shocking to me. It was kind of a whirlwind, but the only thing that I did have afterwards was 6 weeks later, we found that I had retained placenta. Um, so I had to go in and have that removed afterwards because I was having bleeding and abdominal pain 6 weeks postpartum. So we did end up doing that, but other than that, I had no major complications and it was great. So,
Yeah. And there started your passion for VBAC, right?
oh yeah. So, and being a doula after my experience with my doula, I was like, I have to do, I have to do this. So yeah, that's what catapulted me into to being a
Mm-hmm.
VBAC doula. So,
Mm-hmm. Um, I love that you just talked about the amount of education that you did because even like going into your first, right? Um, the hospital birth courses are going to teach you how to be like a good hospital patient, like not necessarily, they're
right.
not used to seeing unmedicated
Oh no, they're
birth.
not.
Right. So, I always recommend anybody to take a child birth education course of like any form because you're going to learn a lot, but don't do it at the hospital.
Yeah.
Um, and um, and I think you just like said something so important, like you never thought about like, what if I have a C-section?
Hmm.
And I think that, so I'm huge on like birth plans, and I think it's so important to include that in a birthing plan. Nobody's planning for this, right? You're not
Hmm.
like, like you said, whether it's an emergency or not. Like I've also been at births where there was pushing for a really long time and they'd been in labor for a long time and they were just done. They were
Yeah.
done. And so what are your options there? What's that going to look like?
Hmm.
And then you kind of have like a little bit of, it's not what you planned for, but at least you know a little bit about it. And
Right.
and so it's, kind of what you're getting into, what's going to happen. Because when they're telling you, here's what's going to happen, da, 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 you're like in a different world.
Yeah.
You're not like, oh, okay, like, can
Hmm.
I have this and this?
Right.
Like you're not thinking about it. Um, but then also then going educating yourself on the VBAC. So,
Hmm.
well, you said one thing with your first, you're like, I wanted an unmedicated birth. But every single person I know who says they want an unmedicated birth, but don't like prepare mentally, end up getting an epidural. And there's
Yep.
nothing wrong with that. It's what you're planning for. And I don't want you to feel like you gave up or that you know what I mean? Like sometimes there can
Hmm.
be guilt after or different things happening. But if you truly want an unmedicated birth in a hospital, you have to really prepare yourself,
Yes. Yeah.
and not with just a hospital birth course.
Hmm.
But we don't know that, right? We're all doing the best that we can. Like nobody told you this. And
Right.
like you said, you were like the first person, like your family was done having kids, your friends hadn't really had any yet. So nobody's like, you know, hey,
There wasn't anyone
this
for
is
me to
what we
talk to
did.
about it. Yeah.
Right, right. And then if you want a VBAC, So, I mean, I definitely live in a little bit of a crunchy world, and it can be like kind of frustrating sometimes when people are like, well, if you want to have a VBAC, you have to birth with outside the system, or you have to, like, if you want the birth you want, you can't be in a hospital. And I get that because I see a lot of births that don't go as planned in a hospital, but one, that's not an option for everybody. Especially when it comes to like insurance, just insurance alone. Like we looked into
Hmm.
home birth with my last one, and like it's all out of pocket. Whereas
Yeah.
like my birth at the birthing center was fully covered.
Right.
So, or even my hospital birth was fully covered. Like it's not always monetarily possible. People
Hmm.
also don't always know their options outside of that. There is still fear around birthing. So people might be like, well, what if this or that,
Right.
Um, but also for maybe somebody just wants the option. Like, I want to try this, but
Hmm.
I feel you have to birth where you feel safest too.
Right.
So
Yeah.
like
Not
if
everyone feels safe like in a hospital, but not everyone feels safe out of hospital. So even if
right,
you're like going for a home birth, if you don't feel safe there, then your birth is
right,
not going to go how it should go because you're not going to be in a safe, relaxed space.
right. And you had these conversations with your provider. So I would love to talk about finding a VBAC supportive provider because
Hmm.
what I see a lot of is providers saying, yeah, of course you can try for a VBAC. And that's the end of the conversation.
Hmm.
And then it doesn't happen. They're
Yeah.
like, okay, well, you're 40 weeks. We have to get this baby out.
Hmm.
Oh, well, we can let you try, but X, Y, and Z,
Hmm.
like there's a lot of stipulations around it that people may not be looking at. They're just like, oh yeah, my doctor said I can try for a VBAC. So they think that they're able to, but maybe they haven't really done a lot of their research or education around it. And they really haven't asked the hard questions to their provider. So I'd
Hmm.
love to maybe just like talk a little bit first, like what exactly is a VBAC? We've been talking about this forever, like VBACs. So it's like a vaginal birth after a cesarean. Um, and then, yeah, what would you recommend like asking a provider to know that you're with one that would actually support that kind of birth?
Yeah, so they're few and far between. I got in the situation where I was extremely, extremely lucky to always have support for what I wanted, and that's not the case for many, many women. But make sure you're asking questions for your provider that are not just like yes and no questions. Like
Yeah,
make them explain something. So like, what are your views around VBAC? Just something as simple as that. Or if I were to have a VBAC, like what stipulations would be put on me? Or like what are your requirements for me for having a VBAC? So a lot of providers will require an epidural for a VBAC just in case. Um, just in case there's like an emergency because then they don't have to put you under general type of thing. And then a lot of them will require induction by a certain point. We know that now with the Arrive trial, all providers are offering induction at 39 weeks, which is just crap.
right.
But even then, if they don't offer it at 39 weeks, they'll say like, oh, by your due date or by 41 weeks, you have to be induced. Other providers will not induce for a VBAC because there is a slight increase in uterine rupture with the use of Pitocin. So they don't want to take that extra risk. So some will not even induce you. They'll just go straight for a repeat C-section at that point. So asking questions that are open-ended and show you like, well, how do you feel about unmedicated birth? That's another big one because um, going unmedicated can increase your chance of having a successful VBAC. So leaving it open-ended like that and really sensing their tone surrounding it. Are they giving you all of the information? Are they covering the risks of VBAC and C-sections,
Right,
repeat C-sections? Knowing those risks and are they answering your questions fully or are they kind of like beating around the bush and like not fully answering your questions? So don't ask just yes and no, like, do you support VBAC? They're clearly just
right,
going to say yes, like unless they
right,
have a
right.
VBAC ban at their hospital or something.
Ugh,
Um,
so
they're just going to,
primitive.
oh, I know. They're just going to say yes. Make them explain to you. Make them take that time to explain it and have a full conversation with them.
Right,
And if they don't, if they refuse to do that or don't do that, then you have like a red flag there that they're not going to be a supportive provider for you at the end. And a lot of providers will seem very supportive at the beginning, but then
right.
once you start creeping up on like 38 weeks, they find reasons to like switch what they're supporting and saying. especially if they're like, oh, this baby's measuring big, like you couldn't get the last one out of your pelvis. So maybe we should induce, or maybe we should just go for that C-section. So yeah, asking those open-ended questions is going to be the biggest thing.
Right. And if they say, well, we can try, we'll see, like those are red flags too.
Oh
Like
yeah, that rhetoric is like, yeah, no, we're not gonna try. We're not just gonna see. Like, if they are
they'd be
clearly,
like, right, you're a great
y-
candidate for VBAC,
right,
like
yeah,
that's an answer
yeah,
you'd love to hear. Like,
yes, yeah,
um, right. So like, let's talk real quick about like, though, why so many doctors won't do it. Like what makes
hmm.
VBAC so risky?
So they the main concern that they say is the risk is uterine rupture. So there is an increased risk of uterine rupture if you have a scar on your uterus. There's
Hmm.
also an increased risk if you just have had a myomectomy in the past, so like
Hmm.
a fibroid removal. You also have about a 1% chance of uterine rupture with that. So it's similar to a VBAC. That is the main concern, but it's still very low. So for most people, the absolute risk, there is a difference between absolute and relative risk,
Yeah.
but the absolute risk is about less than 1%. It varies from about 0.22 to 1%, depending on your situation. Um, but that risk does slightly increase with the use of Pitocin, like an induction. And it is possible, which most people don't realize, to rupture without a scar on your uterus. So
Right.
even first time moms can rupture. It's very, very rare. It's about 0.002 to 0.006% of women that have an unscarred uterus have this rupture. So that is the main concern. There is still a risk of rupture with cesarean, like a scheduled repeat cesarean, but it is lower. It's about 0.16%. Um, or sorry, 0.16%, and that can happen before labor. So you can rupture before labor, during labor, during a C-section. So there is still a risk with repeat C-section, it's just lower. And then the risk obviously increases the more cesareans you have. So that's like the risky thing that they're talking about. But ACOG supports it. So if there is an OB saying they don't support VBAC, they're not listening to their certifying body.
Right.
But yeah, so ACOG will support VBAC after one C-section, even two C-sections. After three, they're like hesitant on if they support that, but some providers will. Every provider is going to be different. Not everyone's going to follow ACOG standards exactly. So,
Right. Right. Um, I think talking about the risk is really important though, because like you said, anybody could have a uterine rupture.
mhm,
Risk does increase, but you deserve to know the numbers to know what the research says,
yeah,
and to make that decision for yourself.
mhm,
Um, and uterine rupture sounds really scary, right? Like it
yeah.
sounds like
That
you're going to
term is
die.
scary. Yeah.
Right. It sounds like, okay, my uterus is going to explode in my body and I'm
Mhm,
going to die. Um, Uterine ruptures are, it sucks. Like, obviously, you don't want that to happen to anybody, but it's very well handled in a hospital.
mhm,
Um, I have heard some cases of where like maybe it was missed, like a mom was complaining and nobody was listening,
right.
which is extremely unfortunate. Um, because you should always be listened to. And if somebody's not listening to you, get louder, get somebody else.
Mhm,
Like if
yeah,
you feel like something ever in birth, like, cause I hear the stories all the time of like, I wanted this and they were telling me no, or I wanted to push
right.
and they're like, no. And I'm like,
Mhm,
like be like, okay, give me somebody else. You know your body best. Um, but I think the key thing here, I would even talk to your provider, like what would happen in a case of a uterine rupture?
yeah, like, how would
Um,
you handle that? Yeah,
right, right. Because like I said, it sounds very, very scary, which doesn't mean that it's not.
mhm,
But they handle it very well. And what a lot of providers aren't telling you are the risks that increase with repeat cesareans.
yes, yep.
So the risk of uterine rupture, yes, does go up. But what are the risks that happen with repeat cesareans?
Yeah. So the main risks with repeat cesareans are going to be placental issues such as placenta previa and then the placenta accreta spectrum. So accreta, where like your placenta actually like attaches to your uterus, and then there's increta and percreta, which is where it like embeds into the uterus. And if it gets severe, like you have to have a hysterectomy.
Right,
So those chances increase with each repeat cesarean. After the third cesarean, they go up even higher than uterine rupture. So if you're wanting to have four, five, six kids and you're having four, five, six cesareans, like risks increase with each one every time that those issues are going to happen with your placenta. And then there's also just the risks of like surgery and anesthesia.
Right.
Your risk for hemorrhaging is higher with a C-section, generally if there's not like a major tear with a vaginal birth or something like that. But your risk of hemorrhaging is higher with a C-section too. So you can't take out the risks of just having a major surgery either.
Right. Um, so I I think like asking about like the risks of both for sure. But even having the conversation, like how many kids do you want to have? Like
Hmm.
that's a conversation to have because I've known several people that wanted multiple children, but were told after their third cesarean, you can't have any more kids.
Hmm.
And they're like, wait, I didn't know, you know what I mean? Like
Yeah.
didn't know because they're like, no, like it's actually dangerous for you.
Right.
Um,
And I'm
so
glad they're saying that though, because I know some women that have had 6 C-sections.
oh God.
So I'm glad that they're saying that their doctors are showing them like, okay, after this third, like your risks exponentially go up because they do. So I'm glad they're actually informing their patients of that.
Right, but they're not informing them before.
Beforehand, yes, yeah.
It's not like, hey, maybe you should try for a VBAC. I mean, how big of a family do you want? Like,
Mhm.
do you want a lot of kids? Okay, then it's probably best that we try to do a vaginal birth because,
Yeah.
well, tell us the risks of, let's say you've had a C-section, then you've had a
Mhm.
VBAC,
Mhm.
you've had a vaginal birth. What risks change after that? Like, if you want to have more kids?
Yeah, so after the first successful VBAC, the data shows the risk for rupture goes down slightly, not like a ton, but it does go down. So having a successful vaginal birth either before or after your C-section decreases that rate of uterine rupture. But the studies are kind of back and forth on like if more VBACs after that decrease your risk of uterine rupture. It's mainly that first VBAC or that first vaginal birth that are going to decrease that risk. Um, so the main risks at that point are still going to be like your baseline uterine rupture after one VBAC. But again, it's very, very low. So those are going to be the primary risks of if you have like 6 more VBACs. And in general, having that many pregnancies, so say you have 6, 7, 8 pregnancies, like your body and your uterus are like, they're getting more stretched, they're getting more worn down just because of what pregnancy does to your body. So having a lot of children in general can increase your risks during pregnancy. But yeah, so that's the main thing. The risk for uterine rupture will go down slightly after you have a successful VBAC.
Mhm. So who would maybe be a good candidate for a VBAC?
Yeah, so if we're going by like ACOG, Western medical standards, good candidates are going to be if you have a low transverse incision, which is like the horizontal incision is going to be the best. A low vertical is going to be like the next safest. Those are like the two that ACOG and the research provides support for VBAC. If you don't have any major placental issues, so obviously if you have like a placenta previa, you're going to have like a scheduled
Yeah.
C-section. Um, if you have, they say, if you're if you're not like a older mom, that it's better, but that's just silly. If you're not geriatric, silly words.
Yeah.
But they say it's riskier if you're older mom. And then a lot of times they'll say if you don't have any major like complications such as preeclampsia or gestational diabetes. So those those are like their guidelines basically. And if you haven't had like a rupture in the past, if they say if you've had a placenta or a uterine rupture in the past that you shouldn't VBAC, but there are women that have. And then they do not support, of course, out of hospital VBACs. ACOG doesn't, but we know that many women go on to have home births after cesarean. It's just not up to ACOG's standards. So those are like the main things. So the low uterine scars, so not a classical incision. But if you do have a classical or a special scar like a inverted T scar or a J scar, there is an organization called Special Scars. People go on to VBAC with those special scars. The uterine rupture rate is just a little bit higher for those types of scars.
hmm So two things. I'm writing down that special scar thing. Um, so you can birth again after having a uterine rupture.
Yes. So someone, I don't know how common it occurs, but if you've had a uterine rupture in the past, the issue with uterine rupture is how someone is defining it because there's uterine rupture and then there's uterine dehiscence. I think that's how you pronounce it. And studies may classify them differently or they may not. So a rupture is a complete separation, apparent rupture like of the scar, like separation of the scar. A dehiscence could be like a partial or like it's kind of opening, but some studies may classify them as the same, so that could skew the actual rate that it's happening. Um, so if you've had a rupture before, you can have a VBAC again. Again, ACOG's not going to support that, and it's going to be hard finding a provider that will support it, but it is possible.
Mm-hmm.
Mm,
So you're kind of like giving us some guidelines for like who would be a good candidate, but like what percentage of women who have had a cesarean,
mhm.
one cesarean, we'll just go, they've had
Yeah.
one cesarean, um, what percentage of them would maybe potentially qualify to have a VBAC?
Depending on the study you look at, it's about 80 to 90%.
And then
So
how
of
many actually are?
about 13 to 14% are choosing to actually pursue a VBAC versus just scheduling that repeat cesarean.
Right. So like 75%, seven,
Are just having
65,
repeats. Yeah.
right, that could potentially have vaginal
Hmm.
births. And it's,
Yep.
I think also, as I said in the beginning, like cesarean's definitely there for a reason. I don't ever want anybody to feel like, like I had to have one or feel guilty for having one. But I do think it's really important to know the evidence because um, there's other risks, like you said, that can happen with surgery. So it's not just, mm, you know, it's not just like the uterine rupture, it's
Hmm.
repeat C-section. Like there's a lot of people too that may, it could affect fertility moving forward because you have a scar
Yep.
right there that could have an underlying infection that like you don't even know is happening. It can cause secondary infertility. It can cause
Yep.
um, just like other issues moving
Major
forward.
pelvic floor issues too. So even like years
Right.
down the road, like 20 years past a C-section, if you're like adhesions or scar tissue, it can affect like your hip mobility and your uterine or not your bladder functioning. It can affect so many things down the road that you're not even aware of, especially
Right.
if you don't do anything to work on that scar.
Right. So there's like other, so for doctors just being like, oh, it's just easier to have a repeat cesarean, that's
Hmm.
not true.
No.
Yes, there's a couple risks that go up, but there's a lot of risks that come with repeat surgery.
Yeah.
Um, and so I think that that's again like just the most important conversation to have, and your best chance at having a VBAC is finding a VBAC supportive provider.
Hmm.
Um, which again, those open-ended questions, right?
Yep.
Like, so like you were saying, like some people were saying that you can't be induced with VBAC. Some people are saying that you have to be.
Mhm.
Um, why, why is there like a back and forth on induction with VBAC?
Yeah, so some providers that are not allowing induction with VBAC, it's just that increased risk of uterine rupture.
Mhm.
So for a VBAC with a Pitocin induction, the risk goes up to about 1.4 to 2.3%, depending on the circumstances surrounding that birth and that pregnancy. So it's still low, but it is higher than if you are not induced. So a lot of providers will just not even take that chance. They'll just go straight to a repeat C-section, which again, we know has risks. And then some require induction. So again, I think it's really coming from the ARRIVE trial. They want to be able to control the circumstances surrounding that birth. Um, so they'll require an induction by a certain date. But what I always tell my clients is even if your provider is requiring you to be induced, you don't have to be induced. You can
Right.
decline that. It is within your rights to decline it. But it's interesting how back and forth a lot of providers are. I see more um, providers that are requiring induction versus they don't allow induction. And I think that's just the commonality of people are inducing more now in general.
Hmm. Right. So many people. Um, so how do you support the women coming to you who want to be back? What is your role in that? And maybe how could a doula help
Yeah, so
that goal?
there's like the three main things I feel like doulas should be doing for VBAC clients because as much as we like wish it wasn't the case, like VBAC clients are treated differently. So we need to be
Right.
supporting them differently. And the first one is really customizing your support for them. So um, a VBAC mom is going to have a lot of times have negative feelings or potentially trauma surrounding her previous birth. So really going through that birth processing with them to make sure there is not going to be any of that coming back up as mental blocks in their future birth, because many women who have had a C-section feel like their bodies failed them. They don't have confidence in their body. They don't feel like they can do it or that they were made to birth. So processing those fears with them, doing fear releasing is a really big thing. And really for all your clients, not just VBAC, but that's a really important step to take, because we know VBAC is that special circumstance where there could be trauma or doubt in their own body involved. So I do that with my clients, but then I do my best to provide like all the resources and education. It depends on where they're birthing too. But even if they're birthing at home, I want them to know what their circumstances would look like in the event of a transfer, and how they're going to be approached for a VBAC at a hospital. So,
Mhm.
providing the research on like the different locations and the different like the stats we've been going over today, because a lot of people are numbers people. A lot of people don't care to hear the numbers, but just knowing those risks and the benefits and going over those stats just kind of like reduces their fear, because from their provider they could just be hearing like, oh, you and your baby are gonna die.
Right.
So really just like being realistic and like laying that out for them. And especially if they don't have a supportive partner at home, educating them as well on all of the VBAC
Yeah.
information. And the other big one is like finding out their why. Like, why do they want a VBAC? Are they truly choosing a VBAC for is that really right for them? Is that something they're wanting? And I think finding their why can really help them stay motivated through the process, and take more ownership of their birth experience, because a lot of times with VBAC clients, they feel like they didn't have a say in their previous birth. They weren't a part of it. They didn't take ownership. They didn't feel empowered. So really having them look inside and do some internal reflection and finding their why and using that as a motivation for their birth moving forward, um, and understanding what it's going to look like if it does end up in another C-section. So I always have VBAC clients make a C-section birth plan.
Yeah.
Um, it doesn't matter if they're like, that's not going to happen to me. I want them to be prepared if it does happen and how I can support them if that does happen. Um, because it is a chance with any birth. Like, I mean, 1 in 3 women are having C-section. So I think it's important to really lay out that plan for both VBAC and C-section, knowing all of their preferences and what they'll do in certain situations.
Yeah. I do think that like 15% of women that are having VBACs are the ones who are doing everything that you said. They're being
Mhm.
educated. They're potentially having a doula there. They're finding the right provider, but still sometimes things do happen. I think that you're obviously way more likely to have one if you're going into this educated and prepared, and
Mhm.
asking your provider the hard questions and going
Yeah.
over everything. But it is so important to have that what if on your birth plan.
Mhm.
Um, Even like I like to put on the birth plans what in case of induction.
Right.
Like what's gonna happen if, let's say you're like, I'm for sure not getting induced, blah, 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 blah. But let's say there is a complication that arises at the end of pregnancy, some hypertension or eclampsia or something um, that maybe it gets to a point where it's healthier to no longer be pregnant versus pregnant.
Right.
Um, what does that look like? What's your education around that? Are you just going to
Mhm.
go in and get on Pitocin, or like, what are your options?
Mhm.
So I think that that's so important because each of those things comes with risk as well.
Yeah.
So,
And I think
um,
it's even more important, and you should be educated regardless and know your options, but in the event you don't have a supportive provider, it's even like more important for you to know your
right.
options, because you're going to have to go in fighting for what you want, unfortunately. And it's not impossible to have a VBAC without support from a provider. Like, I have a very close friend that had a VBAC after 3 C-sections without a supportive provider, and she did it. She just walked in, declined induction, declined her C-section. She knew what she was supposed to do, and she did it.
Mhm.
And she knew what she wanted, and she had that motivation behind her. So it's not impossible without a supportive provider. It just makes it a lot easier if you do have that support.
Yeah, for sure. Especially like with the partner, because if your
Hmm.
partner's scared and
Yeah.
they're not on board. And then as soon as the provider's like, well, I think we should have a C-section. And then your partner's
Mhm.
like, yes, like, I just want you to be safe. And which I get, you know, like I
Mhm.
get, obviously you want them to be safe. You want your baby to be safe, but the fear mongering that goes into it is a huge red flag. Like if you do have a
Yep.
provider playing the dead baby card, that's a huge red flag.
Mhm.
And if you're making a decision based on fear versus like education or information, um, or being feared into something, like that's medical coercion, and
Right.
that's not where you know, like a person you should be birthing with. And but it's easy for our partners to get scared because
Yeah.
they just want what's safest for you, and we think that the doctors know everything. And so when your doctor's like, I really think you should have a repeat cesarean, and then your partner's like, well then yeah, you know.
Yeah.
So how do you get your partner on board?
Mhm.
um because I feel like even like I told you I go on a million birth tangents. So do you. Like my
Yeah.
husband knows so much, but he still, every time I'm going to have a baby, he gets nervous. Like
Mhm.
he wants everything to be okay. He wants me to be okay. He's like, you know, like he trusts our providers, but if in an event they were to say something that I don't agree with, I feel like he would side with them,
Yeah.
you know?
And so many people with VBAC are like, you have to have a supportive provider. Like if you don't, like it's a big deal. But I think having a a partner that doesn't support you is worse than having
Yeah.
like a provider that doesn't support you because they're at home with you every day, talking to you every day, like getting that into your mind. So I think that's way worse than not having a supportive provider. So um, for me, like I think the reason partners are so hesitant, especially around VBAC, is because they're anxious, they may be uneducated, or they, like you said, they may just be scared because it's not their birth. Like they're not going through it. They might not understand like the level of trauma you went through before or what it was like for you, or they may not understand your motivation for it. So sit down and like have a conversation for like, why are you wanting this feedback? Like explain that to them. Um, for me, like my husband didn't truly like, understand the level of trauma I went through for my C-section until I really talked about it with him, um, and, like, my motivation and, like, because I had postpartum depression and PTSD and all this stuff, and he's like, "Whatever you have to do to not go through that again, like, is fine with me." He never even asked about the risks, really, he just knew I was doing all that research, but really, understanding and explaining your why to them, your motivation for it, why it's so important to you, and then educating them. If you're watching a documentary, have them watch it with you. If you're reading the book, have them read it too. Because a lot of times it's just a lack of education and awareness around it.
Mm-hmm. Right. Right. Um, And then for people listening who maybe like aren't planning on having a VBAC, or they're just like not in that situation, but know people around them, like how can we be supportive? Because like being in the birth world, obviously, like I know a lot more information and education than people around me. However, whenever I'm pregnant, people are always saying comments to me. Like for some reason, when you're pregnant, people like to tell you their horror stories that like
Right.
it's not what happened to them. It's their neighbor's sister's
Yep.
dog sitter. You know, like it's like, you know, like just these, it's never like a personal story. It's somebody that they know, or
Right.
it's, you know, it's, we just hear the stories. But like I said, it just kind of in general, I feel like as Americans, we have this like fear of birth.
Hmm.
It's like this scary thing. It's unknown, it's unpredictable, anything can happen. And that's very scary. It needs to be controlled and medicalized. And obviously, there's a huge gap in who's a good candidate for VBAC and who's actually doing it. So there's a
Hmm.
huge gap in there. But if we know people who are maybe having VBACs, like what's something encouraging that maybe those around us can like say?
Yeah, I think the number one thing just in general is people need to be talking about VBAC more. There's not even an awareness that it's an option for so many people.
Yeah.
I've talked to women that I like that have had C-sections, like acquaintances, and when I tell them I had a VBAC, they look at me like I have 3 heads. Like, what? Like
Yeah.
they're shocked or surprised. And then I've talked to people that their doctor had never even mentioned the term VBAC to them as an option. They just had all these repeats. So just really spreading that awareness that VBAC is the thing. It's an option. It is a reasonable and safe option for the majority of women. So having those conversations just spreading awareness basically is the first thing. The second one is like to really encourage women going for a VBAC. Is like you said, not to have share those horror stories, but to share more stories of like this is happening. Women are having these feedbacks in all these situations. And I'm one of those big people where like I want to hear the positive stories, but I also want to hear the negative stories because I want to know what can happen. Like I
Mhm.
wish I would have heard about C-section, like bad C-section stories before my first birth because I didn't know what to expect or what to prepare for. So I think there's a good balance between like hearing good birth stories and bad birth stories so you could understand like what it could look like for you. But yeah, just really sharing like women are out there having feedbacks, like listen to these stories on this podcast, read this book, like this is a possibility for you. Um, and then just listening as much as you can. I know like as doulas, especially we want to talk, like we want to educate, we want to provide all this information. But for anyone having a feedback, if it's like your friend or family member, just listen to them and don't provide input unless they
Mhm.
ask for it. And just listen to what their fears are, what their concerns are, what their hopes are for their birth, and just have conversations with them about it. Because a lot of time, women going for VBACs feel alone because
Mm.
there are so few of them having them.
Yeah.
Um, so they feel alone, but it's important just to listen to them.
Mhm. I think my hesitation with sharing the bad stories though is like, I know so many people that are like, well, the doctor saved me and my baby, but they're created the problem. Like the provider had
Right,
them on
right.
Pitocin
Yeah,
for 24 hours and
yeah,
like, you know what I mean? So it's like, well, this saved my life. You know, I'm way pro C-section, but they're not aware that like their provider created the problem.
right,
So
right.
that's
There's
like
not that
my
awareness there.
hesitation of
Yeah,
like the story sharing, because like our system, obviously, if you're in the birth world, you know, is creating a lot more problems than solving them
yeah,
in the birthing
yeah,
world. So, but I think, you know, if you do know somebody going for a VBAC, being encouraging for sure, and not being like, oh, really, you can do that? That's so scary. Like, can't, you know, just like
yeah.
being like, oh, awesome. Like, tell me more, like being curious. Obviously, if you're listening to this episode, you know a lot more about VBAC. So,
Right.
and then also I have a lot of birth workers that also listen to this podcast. And I know that you have a huge heart for providing birth workers
Mhm,
better knowledge to support women VBACing. So tell us
mhm.
about like what you offer and how in the program that you created.
Yeah, so I have it's a VBAC specific doula training program called VBAC Flow for doulas, and it's a full program with support from me that walks you through like the ins and outs of VBAC. It's primarily for new doulas who are like coming into birth work and they're just like, I don't know what a VBAC is or like how to best support that. So really about the ins and outs of VBAC, how you can support your clients, how you can help them find supportive providers, and how you can help them prepare their mind and body for VBAC. So it's a doula training program. You get a certificate at the end. You get a year of calls with me monthly to go through that and work with other doulas in the area. And then in May, I'm also releasing my VBAC parent course, so VBAC Flow for Parents, which is a VBAC
Awesome.
prep program for women wanting to have a VBAC. So I just think there's more awareness and education in general that needs to be spread about VBAC. And there's not that many options out there currently for VBAC training and VBAC prep. There are a few, but I just think there needs to be more. There's like a million doula like training programs, so why don't we have more VBAC specific ones?
Yeah, I mean, in my original training that I took, we didn't talk about VBAC at all. It wasn't
Yeah.
talked about at all in the training I did. Um, and I ended up having a VBAC client in 2018. That was my first. I really haven't had that many, but I do have one this year. So in
Oh, that's
May,
exciting.
yeah. And so, but I think that the provider again is a huge thing. Like there's one provider here that he'll do VBAC too. So having a
Hmm.
vaginal birth after two prior C-sections, and I don't know anybody else in the Chicago area that does that except for
Yeah.
him. And he has amazing stories, like just people love him. And so she's going to him.
Yeah.
Um, our birthing center, she thought about that, doesn't do VBACs in the area. However, they are working on getting their licensure to do that here,
Hmm.
which is great, but it's it sucks when you feel like you don't have options and you can't find a supportive provider. And that's again, like where that education piece just is so, so important to go in and be informed and educated um, and to not be scared
Yeah.
by people being like, oh, well, you're refusing this. So,
Right.
X, Y, and
Yeah.
Z can happen. And that's even like for me as a doula, I've been in those situations where providers have been fear mongering and like, I got scared,
Right.
where I'm like, oh shit, like, is this
Because
gonna
like a
like, you
certain
know?
wording and like certain ways they phrase it can like induce a lot of like fear emotions. And like even just I've heard things from doctors or stories from people, and I'm just like, well, gosh, like, ugh, I'm lucky that I didn't end up like that. Like that's how I feel. And it's just like unfortunate. Like, yes, these bad things can happen, but at least present it in a way that's not like making us all terrified.
Right, right, for sure. Well, I just want to thank you so much for coming on. Before we wrap up, where can people find you, follow you, learn more about your program, and connect with you at?
Yeah, so my website is ebandflowbirthco.com. I'm on Instagram at ebandflowbirthco, and then my podcast that I just recently rebranded is Motherhood Flow. So
Awesome. Awesome. I will include all the links in the show notes, so it makes it really easy for people to find you. And I just want to thank you so much for your time and energy today and talking all about VBAC, sharing your stories, and going over the research with us. So thank you so much, Hannah.
yeah, thank you so much for having me.